Just because something's common doesn't mean it's normal. Wise words from today's guest, Dr. Will Cole. Dr. Cole is a functional medicine expert from the US who counts Gwyneth Paltrow as one of his friends and close confidants. Today he's going to talk to us about his intuitive fasting plan, amongst other things of healthy lifestyle and diet tips. You're going to be blown away by what he tells you.
Hey, thank you so much.
Would you like to tell our listeners just a little bit about what functional medicine is and what you specialize in?
Sure. So if I had to compare and contrast functional medicine with conventional medicine, the first thing we do differently in functional medicine is that we interpret labs using a thinner reference range. So what I mean by that is anybody that's listening to this or watching this, they'll know, hey, when I get my labs, there's my number on that lab sheet. And then there's this reference range that they're being compared to, this X to Y interval. We get that reference range largely from a statistical bell curve average of people who go to labs. Think for a moment, who are people that typically go to labs? They're people, sadly, that are going through something. I mean, they know intuitively something's off here. My weight loss resistance, my digestive problems, my hair loss, my inflammatory symptoms, my anxiety, my depression, my brain fog, my fatigue. Something's going on here. And the doctor runs the basic labs, and they're told many times, everything looks normal here. You must just be depressed. Take this antidepressant, or you're just getting older. Or many new moms are told, you're just a new mom, or you're just stressed. Or there a lot of medical gaslighting as well. It's like they're made to feel like they're crazy for wanting to find out what's going on. What they're unintentionally telling their patient, to have these symptoms despite these quote unquote normal labs, is you're a lot like the other people with health problems that we're comparing you to. Just because something's common doesn't necessarily make it normal. And comparing yourself to people with health problems is no way for you to find out why do you feel the way that you do. So we're looking at optimal, not average, in functional medicine. We want to compare you, where does vibrant wellness reside, which typically is going to be a thinner range within that larger reference range. That's the functional range. That's where we get our name. Where's your body functioning the best? So if you're not there, can we get you there? And that's going to be our clinical objective there. So there's a spectrum between health and health problems, which I'm sure we can talk about today. But by the time somebody even is diagnosed with a health issue, it's about 4 to 10 years prior to that diagnosis when things were brewing on what I call the inflammation spectrum. So we look at the nuance and the gradient of human physiology and understanding it's not black or white all the time. And you can have symptoms well before it becomes pathological. So that's the first thing we do differently. Second thing is we realize we're all different. And so it's bioindividuality. And you could have 100 people with the same set of symptoms, the same diagnosis code, but the underlying driver of it's completely different. So for fatigue is a good example with that. Okay, well, that's being labeled with chronic fatigue syndrome. It's really not telling you why you have the problem. Anybody that has chronic fatigue syndrome will already tell you, yeah, I already know I'm chronically fatigued, but why? So my job is to figure out, health history, context, labs, what's causing that? Instead of just labeling with somebody with a description of terms, what's the root reason? And there's a lot of nuance and bioindividuality with that. And then we run more comprehensive labs to determine that bioindividuality. So the training in the standard model of care is typically they're trained to diagnose a disease and match it with a medication. So it's sort of this medicinal matching game, which is needed, right? There's many people that need to be on medications and it's appropriate, but there's a lot of people that fall through the cracks of that sort of black and white, let's put you in a box and label you system. So we want to look at underlying gut problems and chronic infections and hormonal imbalances and nutrient deficiencies and trauma and stress and how it impacts the body. So this is sort of the nuanced picture that's underlying pieces to the puzzle. What's the perfect storm of variables that giving rise to this? So it's a lot of Sherlock Holmes on a clinical level, many times, like really investigating and, as I mentioned earlier, holding space for people to really clinically monitor them and coach them and guide them to wellness. So that's what I do. We use food as medicine. We use natural medicines. We use medications when needed. Another word for functional medicine is systems medicine or integrative medicine. So we're really integrating the best of all worlds.
Well, many of our listeners know you from helping Gwyneth Paltrow in around about 2018 when she talked about her perimenopause symptoms. And she describes you as one of the smartest experts she knows in health. How did it come about that you met her and ended up helping her?
Yeah, so I've known her for a long time and she's great. I just know her as one of my patients and friends that I've got to know over the years. And she's passionate about health and wellness. So she's a really great friend in that way. But she's also a really great patient. She's very compliant. Not my only myself, but my entire team. We love people that want to do what we say so
Yeah.
we can get them better. And she's top of the top, like as far as like whatever we say, she will do. And that's brilliant because we can actually get people better. And she's seen great success in that. So yeah, I'm very thankful for all my patients, but especially I think it's good to get the word out there, right? As, like you asking me that question is a good thing. I think it raises awareness around functional medicine. Yeah, so that's I've met her through. I've been a contributor to Goop for a long time. So we have a mutual friend, Dr. Alejandro Younger, who is a cardiologist, and he is also started Clean. What I would say one of the first sort of cleanse resets out there. So I actually met her through Alejandro.
Perfect. And she's done a lot in the US about raising the awareness of perimenopause and menopause symptoms too, which is so helpful generally for women and to normalize that conversation. You've talked briefly on inflammation. You mentioned it just before. And what do you look at for inflammation? Do you look at diet? I know you look at the labs and you look at the results, but how do you then address inflammation in the body?
Yeah. So inflammation is not inherently bad, right? It's a product of the immune system. It fights off viruses. It's needed for a human just feeling great. You need healthy measured inflammation levels. We would be not alive without proper inflammation levels. The problem is homeostasis, right? It's the Goldilocks principle, not too high, not too low, but just right when you need it. The problem is many people have the inflammation too high for too long, and chronic inflammation is really the term for it. So chronic inflammation is associated with just about every health problem under the sun. I mean, many hormonal problems have inflammatory components, what's driving hormonal signaling issues. Whether you're talking about, insulin resistance, obviously is inflammatory, which is a hormone in and of itself, insulin. But then because of the dysregulation of blood sugar and inflammation and that sort of metabolic syndrome, it can throw off a lot of different hormones like the thyroid and estrogen, progesterone, cortisol levels. So there's a ripple effect when one hormonal mechanism is off. It really can cause a cascade of different problems, and inflammation's implicated in that. But autoimmune conditions, every one has an inflammatory component to it. I mentioned diabetes, even brain health issues. I mean, there's a whole field of research called the cytokine model of cognitive function. Cytokines are pro-inflammatory cells. That's research looking at how inflammation impacts how our brains work. So things like anxiety and depression and fatigue. A lot of my work is really educating people on the fact that mental health is not separate from physical health. Mental health is physical health. Our brain is a part of our body, and these things should not be, they should not be sort of relegated to this sort of abstract thing. It's quite measurable when you look at inflammation's implication in people's brain health problems. So how we quantify that is through labs. Health history first and foremost, right? You can actually learn a lot through a comprehensive health history. So the main inflammation tests are high sensitivity C-reactive protein. We want HSCRP to be under 1, above 1. It's a surrogate lab for different interleukins, different types of inflammatory markers in the body. So it's a good way of gauging where inflammation levels are at. There's a lot of reasons why high sensitivity C-reactive protein can be elevated. So it's non-specific, but it's a good way to look at inflammation. Homocysteine is another one that has a lot of exciting research around it. It's an amino acid. Again, just like HSCRP, it's not inherently bad in low levels, but you don't want high levels of this because it's a product of or an aspect, if you will, of methylation, which you need for healthy hormones, detox pathways, healthy brain, healthy mood, and regulating inflammation. So homocysteine should be brought down into something called methionine. But many people have methylation impairments. They have different genetic and epigenetic environmental reasons as to why homocysteine can be elevated. And even such slightly elevated homocysteine, there's studies to show that it can act as a neurotoxin, actually contribute to neuroinflammation and what they call increased blood-brain barrier permeability. So a lot of brain health issues and nervous system issues can be implicated with higher homocysteine. And cardiovascularly too, from a heart attack and stroke standpoint, you don't want homocysteine to be elevated. And then, we get a little bit more granular in functional medicine. We'll look at different gut-centric components to inflammation. We'll look at gut health because that's where 75% of your immune system is. Inflammation is a product of the immune system. So we look at things like calprotectin, lysozyme, lactoferrin, and we look at intestinal permeability or leaky gut syndrome, which can trigger inflammation levels. So there's a lot of sort of upstream root issues that we would look at. And that those things can be the reasons why C-reactive protein or something like that, one of the more conventional markers, could be elevated. So I want to look at inflammation, quantify that, but then it's the commonality between all of these health problems, but what's driving the inflammation itself? So that's where it gets really interesting, where health history and further labs can really say, okay, inflammation's high, that's not good, but what's driving the inflammation? And that's where my work begins.
Brilliant. And what are some of the more common perimenopause and menopause symptoms that your patients might present with, and what do you tend to recommend to your patients, to women?
Yeah. So obviously, perimenopause and menopause is a completely normal stage of life, but people's experience of perimenopause and menopause are completely different. So it's not easy. It's not enough to say, well, I have hot flashes, I have low libido, I have difficulty losing weight, I'm having hair changes, I'm having all of these symptoms. That's just normal. Well, if that was the case, then you would see every person with perimenopause having the same exact symptoms. And we know that's not true. So I don't think it could be a component. Obviously, you're going through a change of life and you're having hormonal changes. But the severity of the symptoms is a pointer that something's unstable and dysregulated that can be stabilized and regulated. So we're going to see the hormonal changes. That's normal. But the severity of what that person's going through should not be normalized necessarily. There's a lot of things we can do to create a better resilience and a greater foundational stability. So perimenopause and menopause will come and go, but the person has an effortless, grace-filled, like easy transition. And just that one factor of insulin resistance that I mentioned, it's the vast majority of people, right? That is like gasoline on the fire for somebody going through perimenopause and menopause. Underlying gut problems, autoimmune problems are gasoline on a fire for somebody going through perimenopause and menopause. So perimenopause and menopause, in many ways, for many people, can be the straw that broke the camel's back, and could be the tipping point, because things were already very fragile. There was not a lot of resilience, and then when that tipping point was made, then it set off a whole cascade of symptoms. So is it really the perimenopause and menopause that's the problem, or was there other things that you actually do have agency over? Like, you can't change if somebody's going through perimenopause, but you can change the core infrastructural things that are at play that's causing the lack of resilience in the first place. So, and then on top of that, downstream, you can, of course, support hormonal balance too. But what I've found is that when you really, let's not control in an obsessive way, but what governance do we have on these core things? When we get those looking really great, i.e. insulin resistance and lowering inflammation levels, improving gut health, improving metabolic flexibility, when we get those, then perimenopause and menopause will be a walk through the park, because it really won't be, it'll be a change, it'll be something to get used to, but it won't be as this violent storm that many people find themselves in.
Yeah, and what would your tips be for insulin resistance or lowering inflammation?
So the first thing, I mean, look, we have to look at the foods we're eating. The foods we're eating are foundational. And even healthy things, what works for one person may not be right for the next person. So there's most of my patients, by the time they've met me, they're eating way cleaner than the average, Westerner. But they are still struggling with these symptoms. So just because something's better doesn't mean it's optimal for you. And that's my job in sort of the science and art of functional medicine as a whole. So I would start with looking at foods that really, for a lot of people, can contribute to metabolic inflexibility. And what I mean by that is the statistics say, I mean, it's anywhere between 70, 90% of people. It's very high, depending on the study that you're citing, of people that are struggling with insulin resistance in some way. Their blood sugars all over the place. Their dysglycemia. They're somewhere on that insulin resistant inflammation spectrum. And they're all the way from, hangriness and mood just swings and weight loss resistance, insatiable cravings, all the way, in the middle part of that spectrum, it's prediabetes, metabolic syndrome, and then it's type 2 diabetes on the other end of the spectrum. So no matter where you're at on that insulin resistant spectrum, and I should add PCOS on that too, polycystic ovarian syndrome is on that spectrum of insulin resistance. So no matter where you're at on that spectrum, what can you do to start to calm and move in the positive direction? So it starts with food. Every food we eat either feeds inflammation or fights it. It's like there's no neutral food. There's no Switzerland meal. It's like doing nothing for your biochemistry. Some in incremental ways, some in negligible ways that maybe you don't notice it, but it's doing something to your biochemistry. It's influencing your biochemistry and your microbiome in some way. So let's really err on the side of what's the most nutrient dense, stabilizing, blood sugar balancing foods out there. And the foods that are most likely to be disruptive to the microbiome and drive inflammation, the foods that are most likely to impact your blood sugar negatively, what I call the inflammatory core four. So these are the four food ingredients to read labels for and check them out that are most likely to drive inflammation and mess up your blood sugar. Number one would be gluten containing grains. So things like wheat and rye and barley and spelt. And you can have a nuanced opinion about this, because I do actually. I think what we've done to the grains more than the grains themselves, especially in the States. Like in the UK, it's like, in Europe, it's less likely to be problematic. But even then, it's becoming increasingly a problem, even in Europe. But it's glyphosate's implication in what's going on there. But beyond glyphosate, it's the hybridization, the genetic modification of the grains. It's a different grain than it was thousands of years ago. But look, humans would have eaten these things when it typically in higher amounts during times of famine, right? Because they stored well. Now we're feasting on famine foods all year round. It is out of alignment with our biochemistry to always be consuming it. And then on top of that, it's not prepared properly. It's genetically modified, hybridized, all that stuff. So it's a confluence of factors. It's not just the grain. But for the sake of simplicity, look at gluten-containing grains. I think sourdough, fermented grains can be fine for some people. Ancient grains can be fine for some people. There's a lot of bioindividuality with this, but so gluten-containing grains would be the first of the four. Second would be added sugar, which is no surprise, right? But even the natural sounding euphemisms for sugar, really educate yourself on the labels and look at the grams of added sugar, because there's things like agave nectar that sound so natural. It sounds like the farmer's just squeezing agave into the bottle and it's just like straight from the earth, but it's in fact quite highly processed, high in fructose, and it contributes to the amount of added sugar you're having throughout the day. So it should be, sugar with a lack of fiber is not good for your metabolism. So we want to definitely look at those added sugars. Third would be industrial seed oils like canola oil, vegetable oil, soybean oil. Again, highly processed, out of the whole food form, and really can be disruptive to the microbiome, pro-inflammatory because of the balance of omegas 3, 6, and 9, which are these polyunsaturated fats that basically the modern Western diet is very high and out of balance with omega 6s, which those polyunsaturated PUFA oils are high in omega-6. So those oils can work if you're eating lots of omega-3s and then you're having not so many of those packaged foods with these industrial seed oils, because they're in a lot of boxed foods, like read labels, because these oils are everywhere. But the problem is people are just having so much of the box stuff with the high omega-6 oils and not enough of the omega-3s, like from wild caught fish and seafood and things like that. So that'd be the third one. And the fourth would be conventional dairy. The problem is most people are just having straight up dairy milk. That's the cows are fed grains and not grass. And then on top of that, what we've done to the cows. So it's what we've done to the industry more than the cow itself. And that's why people then tend to tolerate sheep cheeses and goat milks over the cows, because of the crossbreeding of cows. So you'll see a lot of stores will have cropping up these A2 milks, and that's because they're from these Jersey cows and types of breeds that are still having the old casein that we would have evolved with as humans. Now most dairy has the beta A1 casein, which is more inflammatory. So all of what I just said, it really can seem to be summarized by what researchers call a genetic epigenetic mismatch. Our genetics haven't changed in 10,000 years. All right. But our world has changed very dramatically in such a finite period of time. And you're looking at the context of the totality of human history. So it's the evolutionary mismatch of what's driving this pro-inflammation issues. So start with food. And then from there, we can get a little bit more nerdy and we can get a little bit more functional medicine-y.
Now, that's 4 really easy tips for people to incorporate. And you don't need to go to specialized healthcare shops or anything like that. It's just actually a lot about reading the labels and making sure you're aware of what you're putting in your body, which is great. So thank you for that. What about exercise linked to diet? Are you a big proponent on that as well?
For sure. Exercise, I mean, everybody knows, right? The exercise is good, but I think sometimes they overcomplicate it. I think that the real interesting thing that the science is really pointing to right now is just a little bit of movement. Like after somebody eats, for example, if you just walk or move your body for 10 minutes, it can do dramatic things for your metabolism, balancing your blood sugar, decreasing the glucose spikes. 10 minutes of movement. You can do squats with no weights for 10 minutes, or take breaks, or go on a 10-minute walk, or do just anything that you love that brings you joy and moves your body, gets your heart rate up a little bit, can do really wonderful things. So people think, oh my gosh, I have to be at a CrossFit marathon. I have to be like in a master at weightlifting or cardio. You don't really have to at all. Research shows walking, even for small amounts, can be very, very beneficial for balancing that blood sugar and lowering inflammation. So it is very, very helpful. And we have to consider movement as medicine, because it really is very much so. But be consistent with it too, right? People will go randomly do it and they're not really seeing everything they could be. So it's really about showing up, and even in the small amounts, even if it is just 10 minutes a day, but doing it consistently 10 minutes a day. And then from there, obviously you can build more than that, depending on your capabilities and what you're able to do. Because there are definitely studies that show things like high intensity interval training or HIIT training, burst training, can be very helpful at increasing human growth hormones and balancing blood sugar and increasing lipolysis or fat burning, which all can be beneficial for your metabolism and longevity.
What about HIIT for women of sort of in their 40s and things? Do you still advocate that for them, or should it be more weight bearing exercise?
And I think it should be peppered throughout the week. I don't think it should be their only source of extras, depending on where they're at with their bone health or joint health. But the great thing about high intensity interval training, just like any types of exercise, it can be tailored to your capability. So if we're doing X amount of percentage of your capacity, that's going to be relative for that person. But you can do weight bearing exercises with HIIT as well. If you're doing the appropriate weight, you can, depending on the cycle that you're doing, you really could integrate weight bearing exercises in your HIIT training. HIIT training doesn't have to be entirely cardio. So when we're designing protocols for patients, oftentimes we'll do, bicep curls within the HIIT training, because it's I feel like a combination of cardio and weight bearing can be really nice for a lot of people, and more time efficient for many people that maybe don't have the time to spend longer times in the gym.
You touched briefly on HRT and hormone replacement therapy for women with perimenopause symptoms. I'd love to get your take on that and what place you see it.
Yeah, I think it could be, without a doubt, I see it being a tool within the toolbox for many people. But the problem is, we want to understand the bioterrain and the context of what's appropriate for that person. Because I think sometimes it's the obvious, easy thought, oh, I'm low in this. It's very Western. Like, let's just give it, let's make get some exogenous hormones in the system. And if that's symptom relief for somebody, and if it can be a game-changing symptom relief for some people, then that has merit, has its benefits, and it should be monitored. Obviously, you don't want to be dosing too high. Some of them can come with potential other side effects. You want to be judicious and have it monitored by a doctor. But what I do see, I would say this, is a vast amount of people that are doing HRT but aren't really seeing any benefits from it. It may take the edge off of it. That's how I hear it worded from people. They'll say, oh yeah, maybe it takes the edge off of this, but nothing really else. Or they had a honeymoon period with it where it was good for a minute, few weeks, right, months, and then it would kind of it went away and kind of doesn't help any issues there. So long term. So my interest here from a diagnostic standpoint is to ask the question, what is contributing again to that volatility? What's contributing to that tipping point that's causing these symptoms, like hot flashes or low sex drive or sleep issues or weight loss resistance or anxiety, depression? What's driving that? And yes, estrogen and progesterone, testosterone could be a part of it, possibly. But I'll say this, that I see many people that are teenagers or in their 20s or in their 30s or in their 40s that are not perimenopausal. But when you run diagnostics on them, their hormones look perimenopausal, just like the perimenopausal person. And they have a lot of the same symptoms, right? They have the fatigue, they have the anxiety, they have these sort of female hormone symptoms that many of them can mimic perimenopausal symptoms. So at that point, it's really not there's a lot of female hormonal problems going on that isn't just always blamed to perimenopause and menopause. And back to my earlier statement is that we can make perimenopause and menopause a lot more easy and enjoyable and like steady when we deal with these underlying drivers. So it's interesting that when you deal, like for some, I guess another way of saying this is that when the body's stressed out, and when I say stressed, I mean physiologically stressed, meaning underlying gut problems, is stressful. Chronic infections like mold toxins and environmental toxins, it's stressful on the body. And then not just physiological stress, but psychological stress, like work and your relationships and unresolved trauma from the past. That's also stressful. That shifts the nervous system in more of a sympathetic fight or flight stressed state. Anybody's hormones are going to look not great when you're in that stressed state, because hormones are like biochemical emails. So you really can't expect hormones to be balanced and steady when somebody has those physiological and psychological stressors. It's actually the topic of my next book. It's called Gut Feelings, because we're looking at both the gut and the feelings, the physiological and the psychological. Because I see it on labs every day, and I felt like it needed to be talked about more, because you can't really expect somebody to have great hormonal symptoms when they have both these stressors at play here, this bidirectional component of it. So the point being is when we start dealing with the physiological stressors, dealing with the psychological stressors, the hormones, the estrogen, progesterone, testosterone could still be in the perimenopause and menopause range, but the person feels freaking amazing. So it's kind of like, all right, let nature do what it's going to do. But if they feel amazing, there's really not a need for the hormone replacement therapy at that point. And I would say this, it still may be a tool within their toolbox then, because maybe they got 90% better, right? But they still have this little inkling thing that they want to see. So they try the bioidentical progesterone, or they try the estrogen therapy with their doctor. But I'll tell you what, when the terrain is able to utilize that hormone replacement therapy, it can actually receive it. So you actually make good use because it's a lot more bioavailable. So the person that took HRT in the past that was like, it did a little bit, maybe, it maybe took the edge off. It didn't really do much for me. I will say when the person's health is better, their gut's healthier, their inflammation levels are lower, their blood sugar is more balanced, then HRT may be a very effective tool within their toolbox. But it was just a tool within the toolbox. It wasn't the only tool within the toolbox. So I do find there's a place for HRT, but can we get the body to a place where we can even perceive it and then monitor it with labs? I think the other problem with the HRT is that it's given, but then it's not really monitored on labs very often. It is for some people. I'm not saying for everybody, but I see so many people that they're just like, yeah, I was given it like years ago, but no one's looking at it on labs. And you could be dosing so much higher than what you should be, which can create hormonal resistance and has whole other problems if it's done too much for your body, and every body is different, or you may not be dosing enough. And, and many doctors that are prescribing these things will say, well, just base it on symptoms. You want to look at lab data and symptoms, the subjective and the objective, to really see what's appropriate there. So I think it has its place. I think we just need to clean up how we're integrating this into people's lives.
I completely agree. And we talk a lot about an overall approach to perimenopausal health rather than there being one single thing that you can do. So I think that's so important for everybody to know that it's part of your toolkit. I noticed recently in the research I've been doing around you that you talk a bit about alcohol. And I wonder if you could touch on that and how that maybe influences perimenopausal symptoms.
This is a good question. I'm just laughing because I never make any friends whenever I talk about this. I always lose friends. But look, this is something that I see play out in people's lives. And I had to say, this is a massive problem. I'm so glad that you asked me this because, as I mentioned earlier, most of my patients, almost all of them, eat way better than the average person, right? But they're still struggling. I'll say one exception to this is the alcohol is sort of like glossed over in that conversation for many people that are into quote unquote wellness, right? They'll say, well, I eat super clean, but they're having some people nightly, but other people a few times a week, maybe on the weekends, they're having alcohol and pretty consistently. We have to look at that as far as a variable in why you're stuck at that plateau. And people don't want to look at those areas, but I think the normalization, the glamorization of alcohol within wellness and how it's sort of adopted, because I have to say, look, there are great alternatives for people that if you're going to drink, there are organic, biodynamic, regenerative wine and things like that. That if you're gonna drink a neurotoxin, like let's have the less likely to be. It's still going to be a neurotoxin, but it's all the other offensive stuff around it will be less there. So pragmatically, as a clinician, I realize I'm not going to have a bunch of teetotalers as patients. I have to make some concessions. Say, well, okay, if you're going to have this, have it rarely, and go for the cleaner option for it, certainly. So I think there can be that conversation. I don't want to demonize or shame anybody for their decisions, but I want them to be informed and make the decision for themselves and just use it. Take a mindful inventory of your health and saying, is it serving me? And I would say my experience is patients, when you get them feeling really great, they like feeling great more than they thought they wanted something. They love feeling great more than they thought they missed it, because it's kind of a bad trade-off, having something that's going to dim your light. And if they're going to choose to do it, they're going to choose to do it a lot less often, because it's just, they have a lot more consciousness around it. They have a lot more intuition and mindfulness on what their body loves and what their body hates. And avoiding things that don't love you back isn't restrictive, it's self-respect. And nourishing your body with things that do love you back is a form of self-respect. So it's that paradigm shift. It's not this arduous, restrictive, oh, I can't have that, I'm on this strict diet. No, it's coming from a place of just full confidence that you know what makes you feel good and you love feeling great. So, I mean, the research is clear. Alcohol is a neurotoxin. There's not a healthy amount of alcohol, right? You could make the argument of the resveratrol. I mean, people say that you have to have so much wine to really get the therapeutic doses. And there's a lot safer, cleaner, more effective ways to get therapeutic doses of resveratrol without the neurotoxin. So you don't. That's not a really real reason to have it. You could also make the justification, counter argument, if you will, that it's the hormetic effect, right? It's like a good stress. And I do think that's a relatively interesting position, that if you're having alcohol rarely in small amounts, is it sort of a low dose hormesis on your body where it's kind of making your body a little bit more stressed, so it makes you more resilient? There probably could be something there, but I think there are, again, more effective, less offensive ways to bring hormesis into your life, like high intensity interval training or cold therapy or sauna therapy that doesn't involve neurotoxins. So I think that, but the studies are pretty astounding. The recent studies coming out of all the journals really looking at even small amounts of alcohol are really linking to brain damage, decreased size of brains, impacting brain health and nervous system health. And we know it can increase intestinal permeability or leaky gut syndrome. It really can be an underlying contributing factor to a lot of different chronic health problems. So it's not advised at all, but if I'm going to recommend it for if someone says, no, if I'm going to drink, what would you recommend? Then I would say organic, biodynamic, regenerative wine that's low sugar as well, or like a hard kombucha or something like that. So that's my position on it.
I loved your phrase about it dims your light. I
Mm-hmm.
think there is that sort of, especially in the UK, I think there's a lot about it being a treat at the end of the day or a treat on a Friday
Mm-hmm.
night. And it's just that change in mindset. And don't get me wrong, I'm no angel when it comes to having a glass of wine on a Friday night, but it's interesting to get that mindset shift. And I think that's probably something I need to work on, certainly. We like to end our shows with a sort of top tip. If you have one thing or a couple of things that you could give as a tip for perimenopausal, menopausal women, what would it be?
I would say top tip number one would be looking at those inflammatory core four. That's like foundational. Number two, I didn't say like what foods to then have, right? So second tip would be really eat foods that are nutrient dense, that love you back. Um, Lots of soups and stews I find to be really restorative to the gut-brain axis, which in turn will help the brain hormonal axis, the hypothalamic pituitary ovarian axis, adrenal axis, thyroid axis. So, you can do like bone broth soups and stews. You can do plant-based glangle or kombu or ginger broth, vegetable broth soups and stews. Making sure you're optimizing your protein is essential for anybody, but especially if we're going through any hormonal changes or as we age. So looking at the amount of quality essential amino acids that we're getting throughout the day. So I find it as a mindfulness experiment or into like just to check in with your body and how you're fueling your body is to maybe for a week or so take a week in the life of what you do for breakfast, lunch, and dinner and snacks, and track in a food tracking app. Like it could be Chronometer or MyFitnessPal or something like that. That you'll be able to see all your macronutrients, your proteins, fats, and carbs, and you can see your micronutrients, and specifically not just the micronutrients, which means the vitamins and minerals, which is important to use food as medicine. You definitely want to start with your foods. You can't, supplement your way out of a poor diet. So focus on food is foundational there. But what I mean about protein is to be able to see the 9 or so essential amino acids that you have to get through food. Your body's not able to make it because many people just are not prioritizing protein and not having enough of it throughout the day. So I find that that's very helpful because they can be able to maybe add in an extra source of complete protein throughout their day. Maybe they prefer being more plant-based, or they still need to get essential amino acids. So they need to be a little bit more strategic in how they're optimizing their grams of protein throughout the day. And maybe add in like an essential amino acid supplement. Maybe that's the tip for them. But they'll also be able to look at carbs and like the added sugar tip that I mentioned earlier. Look at the amount of grams of added sugar you're having in a day by using that week or 2 weeks of that mindfulness practice of tracking your food. And then obviously healthy fats are important for hormones for sure. So avocados, olives, wild caught fish, grass-fed beef, like really prioritizing those healthy fats too, which your hormones need fats, your brain needs fats. So basically taking an inventory of your proteins, fats, and carbs. And the third tip would be something that I'm always telling my patients is you can't heal a body you hate. You cannot shame your way into wellness. You cannot obsess your way into health. So all those things that I just mentioned should be coming from a place of self-respect, not out of obsession and negativity. Because I feel like those tools are great, but they really can be abused too. So really start with your heart and what are you feeding your head and your heart, not just what you're feeding your body. So that could look different for different people, but just like really showing the research around self-compassion and gratitude, really exciting. You know, you can lower inflammation tremendously just by showing your body self-compassion, showing yourself self-compassion. And it could be a gratitude practice, a meditation practice, getting out in nature and doing some forest bathing. You know, the research out of South Korea and Japan with Shinrin-yoku really can lower inflammation, but also cultivate a sense of presence and compassion and grace and lightness to all of this, which is, in my opinion, foundational to sustainable wellness.
I love that self-compassion tip. That really touched me. Thank you.
Of course.
Your expertise has absolutely shone through this whole chat. You're clearly so well informed, and I think you've informed our listeners as well. And I'm really grateful for the time you've taken to chat through everything with us. It's been wonderful for me, and I'm sure wonderful for everyone else. So thank you so much, Will Cole.
Thank you so much. Thanks for having me.
A special announcement from Salora, our show sponsor. Salora is a natural monthly supplement to support your mind and body in perimenopause and beyond. As a thank you for listening to our show, claim 50% off your first month using promo code UNPAUSE50 at salora.com.